Good morning, everyone. Go ahead and take your seats. We're ready to get going. Thank you all for joining us here today at the White House, both in the room and those who are joining via live stream. This is an historic event as we kick off the Healthcare Payment Learning and Action Network. We are here today to thank you for your partnership thus far and to discuss the way in which we can continue to collaborate to advance our healthcare system to meet consumers where they are and find better ways to deliver care, pay providers, and distribute information. Now it is my pleasure to introduce the woman who is leading the charge to achieve a health system that can be summed up in 3 words: better, smarter, healthier. Secretary Sylvia Burwell became the Secretary of Health and Human Services in June 2014, and she has a wealth of experience leading large and complex organizations across the public and private sectors. Most recently, she served as the Director of the Office of Management and Budget, but prior to serving in the administration, she was president of the Walmart Foundation, where she led efforts to fight hunger in America and empower women around the world. Prior to that, she was president of the Global Development Program at the Bill and Melinda Gates Foundation. Please join me in welcoming Secretary of Health and Human Services, Sylvia Burwell.
Thank you very much, Karen. And welcome to everyone who's here with us today. It's great to be here today. The President will be joining us a little later this morning, and I actually want to begin by thanking him. Just a few days ago, we had the 5th anniversary of the Affordable Care Act, and with the President's leadership and support, we've started making historic changes to the fundamental structure of our healthcare system. We've seen a historic drop in the uninsured, as about 16 million have gained coverage, and we've seen progress on affordability and quality, but we know we need to do more. For years, we've felt the effects of a healthcare system that doesn't spend our dollars as wisely as it could, that incentivizes quantity of tests over quality of care, that prioritizes volume over value, that addresses conditions often instead of patients. And you can almost sum it up in a sentence: the prices we've paid have outpaced the progress that we've made. It's within our common interest to build a healthcare system that delivers better care and spends more wisely. Since the passage of the Affordable Care Act, we've made important progress, like holding down healthcare price inflation to the lowest rate in 50 years and driving down Medicare hospital readmissions by nearly 10%. It's a good start, and much of it is actually thanks to the visionary leadership and progress that's been driven by the partners that are in this room today. But we're here today because we have a lot more to do, and we want to create that healthcare system that works for every American. We have a strategy to get there: improve how providers are paid, how care is delivered, and how information is distributed. That means prioritizing wellness and prevention and rewarding value and care coordination rather than volume and care duplication. That means improving the way that information is distributed so consumers and providers can access their electronic health information when and where they need it. It means having more cost and quality information for more informed decisions. We've made a commitment to lead this charge where we can, but we know we can't do it alone. It's in all of our interests to work together, and we want to bolster the efforts that you all are already making and give you support where you need it. Many of you asked us for clarity on the direction that Medicare would be taking, and we listened. In January, we set a goal of 30% of all Medicare payments in alternative payment models, such as accountable care organizations, bundled payments, and patient-centered medical homes by 2016. And importantly, 50% of those payments that way by 2018. Many of you were with us when we announced these in January, and since then, many of you have joined in setting goals for your own organizations and communities. I want to thank you all for those who have already stepped up and all of you who have joined this network. And if you haven't, we want your participation because we need everyone in the game. Achieving system-wide improvements and reforms will require a strong partnership across the public, private, and not-for-profit sectors. That's what the Healthcare Payment Learning Action Network is about: working together to figure out what works. We want to hear about your successes as well as your misses. What metrics do you use? How do you define and measure quality? What data can you share? How have you improved the patient experience? How have you learned to better manage care, and what payment models are driving that care coordination? And how have you made your patients active, engaged, and better informed consumers? This meeting today and this network is about action. We need you at this table. We need you talking. We need you sharing. We need your big ideas with payers, providers, consumers, employers, and other stakeholders all working together. We can create change. And if we work together, we will all benefit. Patients will have an easier time reaching their doctor and will be more likely to get the right care at the right time because doctors will be coordinating. Doctors will benefit as we realign the practice of medicine with the best ideals of the profession and simplify the business side of their practices. Businesses will benefit as we hold down the growth in healthcare costs. And we'll all benefit from a more competitive American economy. We're ready to listen, to come together, and most importantly, to act. So thank you all for joining us today, and thank you for the work that we're all going to do together ahead to make a real difference. So thank you all, and looking forward to the day. Kieran?
Thank you, Secretary, not only for your words, but really also for your vision and leadership in pushing us to advance the healthcare system into one that's better, smarter, and healthier for everyone. And I want to thank the administration writ large, including the President, for pushing us to see how we could find ways to accelerate and focus improvements to our healthcare system so that we could have affordable, quality care for everyone in this country. Our work is focused on identifying critical paths that, if overcome, can lead to successfully realizing the vision of a better health system that is truly person-centered and supporting the practice of medicine, and to understand where we should lead and where we should partner. After countless internal and external conversations, looking at the data of what works, where the evidence will drive us, we identified that to get to a better care model, we would need to change the business model. We would need to change the way that we paid providers. We would also need a better information model, all to get to the kind of care delivery model that we all want everyone to enjoy. We looked to see what of our own resources we could leverage. What were the tools that we had at our disposal that could help bring us better care, smarter spending, and healthier people? We looked in the space of better care delivery, and I'll tell you about one of the models that we rolled out last fall. We have an effort called Transforming Clinical Practice Initiative that we rolled out in October, and applications are currently being considered. This will deliver over $800 million to an estimated 150,000 providers to help them redesign their practices and adapt to new payment models. In terms of improving the way in which we distribute information, we're working tirelessly to open up data and put it in the hands of patients and providers alike. And in January, HHS issued its interoperability roadmap, which is available online right now for public comment as a way to improve the transparency in the movement of data to meet patients where they are. And we will continue to improve transparency about the cost and quality of data in the care that you all are paying for, providing, and seeking. And of course, the reason we're here today is to talk about incentives and finding better ways to pay providers, which will result in healthier people and communities. In January, Secretary Burwell met with the health industry leaders, many of whom are here today, to announce measurable goals and a timeline to move the Medicare program and the healthcare system at large towards paying providers based on the quality rather than the quantity of care they give patients. Do better, not more. We recognize that some say the goals announced by the Secretary are lofty, but we believe they are realistic. We have listened and taken into consideration the best ideas from everyone, including members of Congress, and have heard that people are excited about the goals, believe they are necessary, and that they are attainable. You have made it clear that this is what the future should look like. The vision is achievable, but not without your partnership and help. We cannot, should not, and will not do this alone. You all, the private sector and states, are essential to us achieving success. We are not here today to tell you what needs to be done or how to do it. We are here today to hear from you, to begin a partnership and collaboration that will determine what works, what doesn't, where we can help, where we can get out of the way, and eventually to find the best path forward to reach these goals together. Our purpose today and for future meetings of the Healthcare Payment Learning and Action Network is simple. We want to work together to transform the nation's healthcare system into one that achieves better care, smarter spending, and healthier people. It's not a demonstration project or a test model. This is about mainstreaming, and I think you all know that. We want to add certainty to the marketplace to know that everyone, including providers, knows what business model to build for optimal care delivery and see that it is supported by a compatible information model. If we do this right, we will impact the lives of all Americans and ensure that they receive the best care possible in a way that's convenient and enables them to live their lives to the fullest. When I do this work, I think of many of the patients that I've cared for as a primary care doctor in the course of my career. Many of them were challenged with health issues, challenged by the social determinants impacting their lives. You know them. It's people with multiple chronic conditions, multiple dependents, full-time jobs, struggling with finances, transportation, and housing challenges. They frequent the emergency room for primary care because it's not accessible till after hours. They may have 10 different providers caring for them and their symptoms and their diseases. We all know countless patients like this, and they should not have to struggle. They should be able to spend their time, energy, and hard-earned money on the things that matter to them most, instead of wasting any of their precious time or resources navigating the existing and sometimes broken road to sufficient health care. So streamlining, improving the way we pay for care, the way in which we deliver care, and how information is distributed are all essential to improving their lives and the lives of everyone in this country. It's why we are here. It's why we do this work every day. The patient, the consumer, and to bring health to their communities where they live, learn, work, and play. Thank you all for joining us, and thank you all for working with us into the future. Next, I'd like to introduce Dr. Patrick Conway, the Acting Deputy Administrator and Chief Medical Officer for CMS, who will give us an overview of the Healthcare Payment Learning and Action Network and speak to the great progress we have made thus far.
Welcome and good morning. This is truly a historic day. Many of us have been working on this for a very long time. I will tell you, over the breakfast table, I told my 3-, 5-, and 7-year-old about the historicness of this day. And they quickly said, "Can you bring home some White House M&Ms?" So I will work on that before I leave. So we really truly have in this room public, private, nonprofit sector leaders working together, collaborating together, and I think that is the most important aspect. We have set specific goals to move to these new payment models, as we discussed already. And I think the important thing is that for patients in these models, it means better coordinated care. It means getting the care they need at the right time, and really patient-centered care that delivers higher quality, coordinated care to beneficiaries and people across the U.S. In this Learning and Action Network today, which we'll launch, we'll start with brainstorming sessions, because the point is really for people in those rooms to identify what we need to work on. What are the areas that we can make progress on together? So this is not going to be, we are going to lead and catalyze from the public sector, but the public-private partnership here is critical and essential. The network will be fostering collaboration between HHS, state and federal partners, private payers, employers, providers, consumers, and others. And we really think this alignment on alternative payment models such as ACOs or bundled payments or advanced primary care is critical to moving our nation forward. I'll tell you one story from a comprehensive primary care initiative, a 4-clinician practice in rural Arkansas. I've interacted with this practice several times during the course of this model. 3 key points from this model: aligned quality measures across payers representing 80+% of this practice's population. 2, we're all putting in per member per month fees, so putting in capital to this practice to move them away from fee-for-service. They actually, with significant capital going in, had a return on investment in the first year of 3-to-1, bringing out total cost of care of the system. But most importantly, you talk to the physician in that practice, and he talks about, I finally get to practice medicine the way I wanted to. You know, I'm having visits, I've got nurse practitioners, I've got nurses, I've got care coordinators. We visit patients in the nursing home. We send people to their home. We call them about their medications. You know, we've got a pharmacist on staff. This is what we want for our health system. So, you know, as we make these changes together, we also have examples where one payer or purchaser makes a change and then the provider is living in 2 worlds, which makes it incredibly difficult to succeed, where they decrease admissions and on one side in the new payment model they succeed, but on the fee-for-service model they're financially losing. So the point is to align on goals and our approaches. We have over 2,800 registered individuals and organizations that signed up to join with interest in the network, representing physicians, clinicians, urban and rural providers, federal partners, states, counties, municipalities. On the payer side, we have 7 of the 10 largest private payers in this country already committed. And so if you put up CMS and the amount of people we insure, plus these private payers, we already represent the majority of the American population. Medicare and Medicaid are the 2 largest health insurance plans in the world. We cover more than 1 in 3 Americans. We're leveraging opportunities to improve the quality of care that beneficiaries receive while spending dollars more wisely. This is an exciting time in healthcare. We're making dramatic progress. For patients and families, this means a system that focuses on your needs and coordinates your care to keep people healthy and safe. For providers and clinicians, there's an opportunity to realign the practice of medicine with the ideals of the profession, focusing on patient health and the best care possible. As a practicing pediatric hospital medicine physician, I take care of children with multiple chronic conditions, and I can tell you our system can do much better for these children with multiple chronic conditions in terms of keeping them as healthy as possible and as productive as possible and caring for their entire family. For states, as you know, healthcare costs are increasingly a large portion of the budget, and we want to improve the health of populations. From our state innovation models to Medicaid Innovation Accelerator, we know that states and communities are critical partners in this work. For insurance companies, lowering the total cost of care while improving quality means keeping premiums affordable and your customers healthy. As we move to these models, just a couple new additional results. On accountable care organizations, we've showed high level of quality in year 1 and dramatic improvements in quality in year 1 to year 2. We've got over 400 Medicare ACOs in this country delivering results in Medicare, and we've got private sector payers moving in the same direction. Bundled payment, we've got thousands of providers bundling care for things like a hip and knee replacement, improving quality and lowering costs. We're moving in the right direction. The time is now. Collectively, we need you to set bold goals and to continue to drive forward on progress we've made under President Obama's and Secretary Burwell's leadership. This is a top administration priority. Coming together is a beginning. As Henry Ford said, keeping together is progress. Working together is success. So I really want to thank you for your service and being here today. I'm supposed to talk anywhere. I may have to expand my talks until we have the new, which I was pre-warned, anywhere from 45 seconds to 15 minutes, which I have to tell you was a new one for me in terms of the preparation. So I'll tell you a few more results as we wait. Where do I want to start? Actually, I'm going to talk a bit about the afternoon and a bit about our state work, and then we'll transition off as soon as possible. And actually, I'm going to transition off now. So the state work is tremendous. We're working a little bit longer. This is great. This is like charades. Actually, to call out a couple, we have states working on episode-based payments, advanced primary care. We think that partnership, Karen Murphy's, who's in the audience, led this work for us. And I can tell you the partnership with states and communities is just critical to drive this work. And we've got a number of you in the audience. You know, I also think another piece that we really didn't talk about is our health plan innovation work and some of our consumer engagement work. We think this is critical. We know those partnerships and working together is what will move our nation forward. I've dedicated my life to improving the healthcare system of America. I was talking to my mom on the way in, who is going on a trip to Florida, and I will say, she once again said, you know, I have to say, 20 years ago, I never would have thought you would be where you are today. So I didn't know what to make of that. And with that, I'd say I'm incredibly excited to recognize our next speaker, the President of the United States. Please, I want you to stand up, give yourselves a round of applause for being here today, and also to improve the health system of America, and applaud for a very long time to bring in the next guest. Thanks a lot.
Ladies and gentlemen, the President of the United States, accompanied by Dr. Nancy Buren.
Hold on a second. There you go.
Now I feel taller.
Hey.
Good morning. Good morning. I'm Nancy Buren, and I'm a practicing internist that focuses on women's health. I went into medicine for all the typical reasons. I wanted to help people, I was good in science, I was caring. Primary care was my natural fit, so I followed my heart and I didn't look back. I work in a wonderful practice with another fabulous physician, and in 2010, we were fortunate enough to embark on a transformation journey that enhanced our goals as physicians and provided better access and quality care to our patients. Our practice thrived and grew as we became a patient-centered medical home. Thanks to the funds made available through the Affordable Care Act, small practices such as ours have continued to innovate, change, and lead. As a primary care physician, I believe it is our responsibility to advocate and care for patients. And today I'm honored to introduce to you a visionary in healthcare reform, the President of the United States, President Barack Obama.
Good job. Keep up the good work. Thank you. Thank you so much, everybody. Thank you. Thank you. Everybody have a seat. Thank you, Doctor, for that introduction. I want to thank Sylvia Burwell, our outstanding head of Health and Human Services. We've got some wonderful members of Congress here today who helped make this happen. And I want to offer a heartfelt thanks to all of the top medical professionals who are here today. We've got hospital leaders, we've got healthcare CEOs, doctors, patients, advocates, consumer groups, Democrats and Republicans, who've all come together and spent time and effort to make the Affordable Care Act and America's health care system work even better. And what your efforts have meant is the start of a new phase where professionals like you and organizations like yours come together in one new network with one big goal, and that is to continue to improve the cost and quality of health care in America. A lot of you have already taken steps on your own. The American Cancer Society, that's represented here, is committed to teaching its members about how new patient-centered approaches can improve cancer care. Governor Markell of Delaware, who's here, has set a goal of having 80% of his citizens receive care through new and improved payment and delivery models within 5 years. Dr. Glenn Madrid of Grand Junction, Colorado, is using a new care model that allowed him to hire case coordinators and use better technology so that patients have access to him 24/7. I don't know when that lets him sleep, but his patients are sleeping better. And these are examples of efforts that show we don't need to reinvent the wheel. You're already figuring out what works to reduce infections in hospitals or help patients with complicated needs. What we have to do is to share these best practices, these good ideas, including new ways to pay for care so that we're rewarding quality. And that's what this network is all about. In fact, just 5 years in, the Affordable Care Act has already helped improve the quality of health care across the board. A lot of the attention has been rightly focused on people's access to care. And that obviously was a huge motivator for us passing the Affordable Care Act, making sure that people who didn't have health insurance had the security of health insurance. But what was also a central notion in the Affordable Care Act was we had an inefficient system with a lot of waste that didn't always deliver the kind of quality that was needed, that often put healthcare providers in a box where they wanted to do better for their patients, but financial incentives were skewed the other way. And so the work that we've been able to do is already spurring the kinds of changes that we had hoped for. It's helped reduce hospital readmission rates dramatically. It's a major reason why we've seen 50,000 fewer preventable patient deaths in hospitals. And if you want to know what that means, ask Alicia Cole, who suffers, Alicia's right here, who suffers the long-term effects of a hospital-acquired infection. And she's here today because she doesn't want anybody else to endure what she has. And it's preventable if we set up good practices and financial incentives, reimbursement incentives are aligned with those best practices. So making sure that the Affordable Care Act works as intended to not only deliver access to care, but also to improve the quality of care and the costs of care, that's something that requires all of us to work together. That's part of what the law is all about. It's making health care coverage more affordable and more effective for all of us. And in a lot of ways, it's working better than many of us, including me, anticipated. Wherever you are, here's why you should care about making this system more efficient. And here's why you should care that we keep the Affordable Care Act in place. If you get insurance through your employer, like most Americans do, the ACA gave you new savings and new protections. If you've got a pre-existing condition like diabetes or cancer, if you've had heartburn or a heart attack, this law means that you can no longer be charged more or denied coverage because of a pre-existing condition, ever. It's the end of discrimination against the sick in America, and all of us are sick sometimes. If you don't have health insurance, you can go online to the marketplace and choose from an array of quality, affordable private plans. Every governor was given the option to expand Medicaid for his or her citizens, although only 28 have chosen to do so far. But after 5 years of the ACA, more than 16 million uninsured Americans have gained health care coverage. 16 million. In just over 1 year, the ranks of the uninsured have dropped by nearly 1/3. 1/3. If you're a woman, you can no longer be charged more just for being a woman. And you know, there are a lot of women. Like more than 50%. Preventive care like routine checkups and immunizations and contraception now come with no additional out-of-pocket costs. If you're a young person, you can now stay on your parents' plan until you turn 26. And if you want to turn that new idea into a business, if you're going to try different jobs, even a different career, you now have the freedom to do it because you can buy health care that's portable and not tied to your employer. Most people have options that cost less than $100 a month. If you're a business owner, because when we put forward the Affordable Care Act, there was a lot of question about how it would affect business. Well, it turns out employer premiums rose at a rate tied for the lowest on record. If premiums had kept growing at the rate we saw in the last decade, then either the average family premium paid by the family or paid by the business would be $1,800 higher than it is today. That's $1,800 that businesses can use to hire and invest, or that's $1,800 that stays in that family's bank account, shows up in their paycheck. If you're a senior, more than 9 million seniors and people with disabilities have saved an average of $1,600 on their prescriptions, adding up to over $15 billion in savings. There were fears promoted that somehow this was going to undermine Medicare. Well, it turns out the life of the Medicare Trust Fund has been extended by 13 years since this law has passed. And, relevant to the topic today, we're moving Medicare toward a payment model that rewards quality of care instead of quantity of care. We don't want the incentives to be skewed so that providers feel obliged to do more tests. We want them to do the right tests. We want them perhaps to invest some money on the front end to prevent disease and not just on the back end to treat disease. And so these changes are encouraging doctors and hospitals to focus on getting better outcomes for their patients. As we speak, Congress is working to fix the Medicare physician payment system. I've got my pen ready to sign a good bipartisan bill, which would be really exciting. I love when Congress passes bipartisan bills that I can sign. It's always very encouraging. And I want to thank everybody here today for their work in supporting new models of care that will benefit all Americans. But the bottom line is this for the American people. The Affordable Care Act, this law, is saving money for families and for businesses. This law is also saving lives. Lives that touch all of us. It's working despite countless attempts to repeal, undermine, defund, and defame this law. It's not the job killer that critics have warned about for 5 years. When this law was passed, our businesses began the longest streak of private sector job growth on record. 60 straight months, 5 straight years, 12 million new jobs. It's not the fiscal disaster critics warned about for 5 years. Healthcare prices are rising at the slowest rate in nearly 50 years, which has helped cut our deficit by 2/3 since I took office. Before the ACA, healthcare was the single biggest driver driving up our projected deficits. Today, healthcare is the single biggest factor driving those projections down. I mean, we have been promised a lot of things these past 5 years that didn't turn out to be the case. Death panels, doom, a serious alternative from Republicans in Congress. The budget they introduced last week would literally double the number of uninsured in America. And in their defense, there are 2 reasons why coming up with their own alternative has proven to be difficult. First, it's because the Affordable Care Act pretty much was their plan before I adopted it, based on conservative market-based principles developed by the Heritage Foundation and supported by Republicans in Congress and deployed by a guy named Mitt Romney in Massachusetts to great effect. If they want to take credit for this law, they can. I'm happy to share it. And second is because health reform is really hard, and the people here who are in the trenches know that. Good people from both parties have tried and failed to get it done for 100 years because every public policy has some trade-offs, especially when it affects 1/6 of the American economy and applies to the very personal needs of every individual American. And we've made our share of mistakes since we passed this law. But we also know beyond a shred of a doubt that the policy has worked. Coverage is up, cost growth is at a historic low, deficits have been slashed, lives have been saved. So if anybody wants to join us in the spirit of the people who've put aside differences to come here today and help make the law work even better, come on board. On the other hand, for folks who are basing their entire political agenda on repealing the law, you've got to explain how kicking millions of families off their insurance is somehow going to make us more free. Or why forcing millions of families to pay thousands of dollars more will somehow make us more secure. Or why we should go back to the days when women paid more for coverage than men. Or a pre-existing condition locked so many of us out of insurance. And if that's your argument, then you should meet somebody like Ann Ha, who's here. Ann's 28 years old. Where's Ann? There you are. Ann runs her own business in Philadelphia. And she thought what many of us think when we're young, I'm no longer qualified, that she was too young, too healthy to bother with health insurance. She went to the gym every day, she ate healthy, looks great, felt invincible. Why pay a doctor just to tell her she's okay? But then her mom called, as moms sometimes do, and told Ann to get insured against the what-ifs of life. What if you get sick? What if you get into a car accident? So Ann, dutiful daughter that she was, went to healthcare.gov, checked out her options in the marketplace, and thanks to the tax credits available to her under this law, she got covered for $85 a month. 4 months later, Ann was diagnosed with early-stage stomach cancer. Ann underwent surgery, endured chemo. Today she's recovering. She looks great. She's here with us at the White House. She invited me to her wedding. I told her you don't want the president at her wedding. If I didn't have insurance, Ann wrote, my stomach cancer would have gone undiscovered, slowly and silently killing me. But because I did have insurance, I was given a chance to live a long and happy life. And so in September, Ann's going to be marrying her fiance, Tom, and she's convinced him to get covered too. And I do appreciate, Michelle appreciates the invitation. As I said, we have to mag people if you at the wedding, and it spoils the fun. But here are 2 lessons from Ann's story. Number 1, listen to your mom. Number 2, the Affordable Care Act works. And it's working not just to make sure that folks like Ann get coverage, but it's also working to make sure that the system as a whole is providing better quality at a better price, freeing up our providers to do the things that led them to get into healthcare in the first place, and that's help people. It works. 5 years ago, we declared that in the United States of America, the security of quality, affordable health care was a privilege, was not a privilege, but a right. And today, we've got citizens all across the country, all of you here today, who are helping make that right a reality for every American, regardless of your political beliefs or theirs. And we're saving money in the process. And we're cutting the deficit in the process. And we're helping businesses in their bottom lines in the process. We're making this country more competitive in the process. And it's not going to happen overnight. There's still all kinds of bumps along the way. Healthcare is complicated stuff. And the hospital executives who are here, and the doctors who are here, and the consumer advocates who are here can tell you all the complications and the quirks, not just to the Affordable Care Act, but just generally making the system more rational and more efficient. It takes some time, but we're on our way. We're making progress. And if all of us summon the same focus, the same kind of courage and wisdom and hard work that so many of you in this room display, and if we keep working not against one another, but for one another, with one another, we will not just make progress in healthcare, we're going to keep on making sure that across the board, we're living up to our highest ideals. So I very much am appreciative of what all of you are doing. I'm very proud of it. And why don't you guys get back to work? Thank you very much.
that all those smart women
Yes, clearly.
knew who they needed to talk to.
It was like a receiving line outside.
Yes. Yes.
Thank you again to everyone who is here today. I'm Mina Seshmani. I'm the Director of the Office of Health Reform at Health and Human Services, and I'll be moderating the panel for this event. Following the President is a pretty tough act to follow, but if anybody can do it, it's this panel. This is a panel of leaders across the healthcare sector. We are so pleased to have this opportunity to be able to highlight and learn from all of the innovations that they're a part of on the ground to improve quality and value across the system. They are spearheading creative programs to help their employees manage chronic disease and illness. They're at the vanguard of state-level reforms to their delivery systems. They are bringing data to the point of care to improve the patient experience. And they are working directly with patients and their families to educate them about what value and quality mean and to ensure that their voices are heard. They are also leaders in that each of them has set goals to match or exceed the direction that Medicare is moving to reward providers for the quality of care, not just the quantity of care they provide. So today we're joined by Dr. Nancy Beeran, who's Chief Medical Officer at Westchester Health, Mr. Bruce Broussard, who's CEO of Humana, Mr. Lloyd Dean, CEO of Dignity Health, Mr. Gary Loveman, CEO of Caesars Entertainment Group, Governor Jack Markell of the state of Delaware, and Ms. Deborah Ness, President of the National Partnership for Women and Families. So to kick it off, I'd like to ask each panelist to say a few words about themselves, about their organizations, and about their goals and their work to date before we have a little bit of time for some questions and discussion.
Hi, I'm Nancy Beeran. I'm a practicing internist, and I'm the Chief Medical Officer of a multi-specialty group that's about 120 physicians. And we are located in Westchester County, New York, which is about 1 hour north of Manhattan. We have about 50 practice sites, so mostly small practices, and have been working on transformation and quality programs for the last 5 years.
I'm Bruce Broussard, CEO of Humana Corporation. We are nationwide, and our primary area for what we're most known for would be Medicare Advantage and Part D. We have about 20-some% market share in those particular markets, and is well known in that. The company's been around 52 years. It's a unique organization from the standpoint we actually started as a nursing home company 52 years ago. And then we transitioned to a hospital company in the early 70s. And then we transitioned to a staff model in the 80s where we owned hospitals and we started a payer corporation. And then in the 90s, we actually converted, sold off the hospitals, and we stayed as a payer. We've been in the Medicare program for the last 25 years through its good and bad, and we find today, and this today is a great example of the partnership that can be had between the private and the public sector.
Thank you. I'm Lloyd Dean, President and CEO of Dignity Health. Very quickly, Dignity Health is one of the nation's largest integrated delivery network. We're headquartered in San Francisco. We currently have care sites in 21 states. Very proud of the fact that we've had the opportunity to work with the President and administration from the inception of the ACA and work and partner with many of the people in this room. And we're just very excited about this next phase that we'll be talking about.
My name's Gary Loveman. I'm the chairman and CEO of Caesars, and while Caesars is no more distinguished than these other companies, I suspect we're more fun. And we also never close. Anytime you need us, we're there.
You got more money.
I would, we noted a long time ago that the quality of the experience of our guests has everything to do with the quality of the experience we provide to those who work with us. And the 72,000 folks that work with me in this regard are interested especially in the quality of they and their families' health care. So we've tried to establish an innovative approach to their wellness that includes many of the features of the Affordable Care Act and the remarks that were made by the Secretary and the President this morning, and we're very excited to support their efforts to move this now into delivery system reform.
I'm Jack Markell. I'm the governor of the state of Delaware, and I was so thrilled when I heard that this event was taking place, because I think with all of the focus on the Affordable Care Act and the website and everything else, I think there's not been nearly enough focus on the most important part, the most underreported story with respect to health care, which is the effort to transform the way that we deliver and pay for health care. This is, as the President said, and I thought he did a great job framing it, I think this is incredibly, it's a big lift, because you're talking about changing the way an entire industry gets paid. But there's no question that if we are going to reduce the growth in healthcare costs, we've got to move away from the fee-for-service model. And so we are just about wrapping up 2 years of work where we've had all the stakeholders in Delaware at the table, our hospitals, our physicians, other healthcare professionals, our payers, our business community, all at the table figuring out how can we work together to transform the way we deliver and pay for healthcare. I really want to give a big shout out to HHS, to Patrick Conway. We were one of the states that has benefited from a $35 million grant for the state innovation model, which is accelerating work that was already underway in our state, but we do in fact have an intention of shifting a very significant portion of our healthcare spending away from fee-for-service and more to a value-based model over the next few years. It's very difficult, but it's also that important. All you have to do is look at the budgets of any state, or for that matter, really any company, to see what a large share is still taken up by healthcare, and we have got to bend that curve. And I think this is the best opportunity we will have in a long time to achieve the triple aim of access, and as the President said, great progress being made on access, but also to improve quality and focus on affordability as well. And what an incredible opportunity it is.
I'm Deborah Ness, and I am president of the National Partnership for Women and Families. We're a national nonprofit consumer advocacy organization that's been around for over 40 years. And we are working not only to ensure that people have health care coverage, but to make sure that that coverage indeed provides them with the best health outcomes, the best kind of care, and the smartest spending possible, which is what today is all about. One of the things that I think is so remarkable about today is that this conversation about moving from volume to value really represents a major culture shift, a real paradigm shift for our healthcare system at large. And it means every stakeholder has to change. The providers of care, the payers of care, and even the consumers, the patients and families who receive care. And to that end, I think there's another part of this paradigm shift that we have to keep in mind, and that HHS has so clearly embraced. And that is that we can't get to that triple aim unless we begin to see patients and families and consumer advocates as co-creators of health and health care. We can't expect to get to a system that meets that triple aim, that meets the needs of patients and families, if they're not there at the table helping to shape that design, shape the care. And we have a history in healthcare of a mindset where if we build it, they'll come. And this time, I hope we do it in a way that we build it with them, and that they're already there, they meaning the patients and families engaging with us. Then I think we get to a care system that leads to giving people who most need it, the elderly people with multiple conditions and multiple specialists and multiple prescriptions, the kind of care they need. The low-income pregnant women with high-risk pregnancies, the care that they need. The cancer patient with complex need for the best evidence-based medical care, but also need for support services and palliative care. That's the kind of care we want. That's what the triple aim is all about, and my hope is that we can co-create this together.
Thank you to all of you. So I have a few questions for each of you, and perhaps we'll just go down the line again. So first, Dr. Biren, you did mention when you introduced the president about the work that you have done in your practice in Westchester Health on creative work with leveraging data and data analysis and improving care coordination. If you could speak a few words about that, as well as how you've been able to use data to improve care for your patients and what best practices you can share from that.
So we've used data in a lot of ways. We've used data to track our patients in terms of risk stratification. So we've used data for giving everybody a risk score across our population, risk stratifying our patients. Then we can use that to make sure that we are taking care of the sickest patients in our population and making sure that those patients are getting the care that they need, working with embedded case managers along that way. We are using data for quality. We're tracking quality reports across all different of our populations, looking at quality metrics for our providers, looking at how well they're doing against benchmarks, how well they're doing against each other, and then setting bars for improvement for our physicians. We are looking at ways for gaps in care so that we can alert physicians when there are gaps in care, and ways to make not just for physicians, but ways to take some of that work burden out of the process for the physicians. Not all gaps in care need to be done by a physician. Much of that workflow can be done by an administrative support staff. So we're looking at what needs to be done to support population health and at the appropriate level, and then building that infrastructure to do that. We have multiple small practices in our group, and we have many of them that are in the Comprehensive Primary Care Initiative. And we've looked at what resources you need to pool together and say, okay, where can we build the infrastructure centrally so that we can leverage it to the greatest good for everyone?
Thank you. Next, Mr. Broussard at Humana. You yourself called it the bold goal in Medicare Advantage of 75% in accountable care organizations by 2017. So I was hoping you could speak a bit more of what you've learned about what makes for a good patient experience in these models so far, and how can other payers learn from your experience?
Yeah, I think a few things. We today actually have about 50% of our members under value-based reimbursement. And there's a few things that we have learned in that, and I'll get to your experience question in a second. Is first, and this is especially, I think, applicable in areas that the individual needs help on. At first, the chronic conditions are a very important area to focus on. We have found the biggest impact on value-based reimbursement is in the areas around that. And what's interesting is the healthcare delivery system today has not evolved to our society needs. Our society has really become more chronic in its conditions, but our system today really reimburses off an episodic area. And when you think about it, chronic is not one and done. It is a lifestyle change. And so when we have a conversation with a member around their health and prevention and ensuring they're adhering to their proper prescriptions, ensuring that they're walking and those kind of behavioral, it makes a big impact. And so when we think about not only the bold goal of getting to 75%, we think about the impact we have on the individuals, and we've seen some great results of that. We've seen improvement in the preventions area around diabetics and the ability for them to continue to follow their particular lifestyle needs. We've seen great in the cancer area, prevention and testing, and the story that was just said by the president is a good example of that. But what it's done is it's wrapped the conversation around the journey of someone's health around as opposed to the treatment. And if there's anything I can emphasize in this group, it's really changing the healthcare system from a treatment to a health-oriented area. And that's been the biggest impact that we've seen in the experience, and again, especially around the chronic conditions. Yeah.
Great, thank you. Mr. Dean, you started one of your accountable care organizations before the ACA was passed. As one of the largest provider systems in the nation, what led you to that point? And have you been able to replicate that success across your system?
Yes, thank you for that question. I just want to preface my comments by saying that it's truly a pleasure to be on this podium with this distinguished group of individuals, and particularly sitting next to Gary, because I have invested heavily in his enterprises. I have yet to get any return, but to his point, I'm almost having fun.
Good.
But specifically,
may you live a long and healthy life.
But specifically to the question, we did certainly jump on the opportunity to institute ACOs early in Dignity Health and with some partners here. What was the motivation for that? We recognized, as many of the folks in this room have, and the President referenced, that the cost escalations that historically were happening in our country just were not sustainable. And secondly, we had the opportunity to partner with CalPERS, and many of you know the size and scope of that organization, and we wanted to make sure that we had created a product that would be attractive to them. And we learned a lot. Anytime you bring a physician group together, a provider, a major insure, working for an organization like CalPERS, we learned that formalizing that partnership and building those relationships is not only key, but necessary in establishing the trust was something that we certainly were able to accomplish, but early on was a challenge. So now we are expanding that model and we are replicating it with new partners throughout the geographies that we have. And I think the important takeaway here is that not only were we able to improve care to the CalPERS members, but we saved money, but most importantly, we saved lives. So it has been a good model for Dignity Health. It's been good for the patients. And one of the things that we learned is that with the right relationships and with the right motivation and focus, it is scalable.
Great. Thank you. So we have 3 minutes left and 3 more people, so this is right on track. So, Mr. Loveman, earlier this year you launched a pilot program to implement bundled payments for certain surgeries. Why did you, and why should an employer in general consider programs such as bundled payments, and what have you learned that you can share with others?
Many large employers that have been looking to how to improve health and wellness and reduce cost among its employees have put information, incentives, choice, and some level of convenience in front of our colleagues and encourage them to make more informed decisions. I think the next step in this process is the provision of bundled care. In our case, we've launched a pilot in Reno, Nevada, where we've encouraged those who are facing joint replacement decisions to consider either whatever set of a la carte services they choose on the one hand, or on the other hand, a bundled offering that has been put together on our behalf by local experts that combine orthopedic surgeons, rehab services, as well as the in-hospital portion of the experience under a capitated cost structure that then we're able to give to the employee a substantially lower out-of-pocket cost if they undertake that procedure under these circumstances. So for us, the cost of what is an elective but important procedure goes down very substantially. We believe the quality is superior to the other local alternatives, and for the individual, we believe they will have both a better health outcome and substantially lower out-of-pocket cost. So this is quite consistent with the spirit of what you all at HHS are proposing for the public payer systems, and I think you'll see this percolate through private employers as well.
Thank you. Governor Markell, what have been the keys to Delaware's successful efforts to spur state-based innovation, and what early lessons have you learned?
So I mentioned earlier the importance of engaging all stakeholders, and that has to be more than rhetoric. And what it means is we really have to understand the dollar flow, and we can't expect people to act in any way other than in their own enlightened self-interest. And so, I mean, that is the nature of the beast. But and let me give you an example. So we have a health system in Delaware that has been thinking innovatively about trying to work with patients who have had cardiac problems, identifying who they are, and then using technology to sort of follow them while they're at home if they're having, if they're gaining weight or if they're having other issues that could be a precursor to a further problem. So as they do that, if they're following the people, they may send a nurse out to the home. They may do other kind of work to avoid that person being hospitalized for a cardiac condition. Well, that's great. The problem is the way the current financial system works is there's no particular incentive for that hospital to do that. And so, historically they wouldn't have. And so what we've really been focused on in our state is coming up with a different payment model so that those kinds of decisions will be rewarded, and so that investors, whether it's a for-profit or not-for-profit, whether it's private physicians, whoever can continue to earn a real return. And the reason this is so complicated is, in fact, because you're changing the way an entire industry gets paid. But if you can, work really hard with all the stakeholders to align those incentives in favor of the patient's health, rather than just having more procedures performed, then you can get somewhere. I don't underestimate the difficulty, but I think after 2 years of work, having all the stakeholders at the table in more than name only, and having them recognize this can't be, although I'm the governor, this can't be my initiative. This has to be an initiative of the entire healthcare community in our state, and then we have a chance of pulling it off.
Thank you. And Ms. Ness, when we talk about payment reform and delivery system reform, it can be difficult to explain why it matters to the average consumer. How can we keep patients engaged and at the center of these discussions? And what does payment reform look like and mean for consumers?
Okay, well, it's absolutely clear you're not going to have people rallying in the streets for payment reform. But I believe if we build a system that meets their needs, they will engage, and that's why it is so important to build it with them. I believe, I hear a lot of folks ask me, for example, in the ACO world, what can we do to get patients to stick, to assign themselves? And I want to say, well, what are you doing to make them want to stick and assign themselves to your care? So as I go out to talk to people about what this really means to them in terms of their care, I talk about the fact that it's the promise of really being able to have a primary care provider with whom you have a trusted relationship, who knows you and enough about you to make good recommendations that take your needs and circumstances into account. It's about coordination of care. It's the idea of your different doctors talking to each other, which for many patients right now represents a huge burden. It's making sure that somebody is helping you navigate and understand what all those different specialists are telling you and putting it all together in a way that you can make good decisions. It's about partnership. We like to talk about shared decision making, but if you step back, shared decision making is a moment in time. You can't have an unengaged relationship with patients and then suddenly pull them in at a moment and say, now we're going to share a decision with you. It has to be a shared partnership, starting with goal setting and care planning, including the decisions about which treatments to make. And finally, we've talked a lot about access to care that patients can get when they need it, answers to questions, the kinds of things that keep you from going to the emergency room and getting admitted for a hospitalization. More and more, we're seeing payment models that are helping to reward that kind of access that gets people the right care at the right time. And I think the last thing I want to say is transparency. People will only go if they believe and trust that what they're getting is better. And we need to be able to show them with good measures that what they're getting is better. Those measures have to be meaningful to patients, and we have to be willing to make that information transparent. And if we want them to make decisions that are value-based, then they have to see information about both quality and cost. Thanks.
Thank you. And Dr. Buren, you wanted to add one more thing.
I just wanted to add that, as we build these new models, whether we're building larger models such as accountable care organizations or whether we're building advanced primary care medical homes, the incentives have to be aligned. And I think it really tags on to what you're saying, Deborah, that really we're trying to take the incentives. The payers have to be aligned with the providers and with the needs of the patients so that we're building models that work, that improve the quality of the care, that meet the goals of everyone at the table. Because when the incentives aren't aligned, the models fail. whether they're big models or small models, they have to have enough at stake for the doctor to change, for the patient to be engaged, and for the payers to be engaged. And that's what we see as a small practice. So it can work for small practices, but if it's not enough alignment of the payers, then we don't see enough movement of behavior for the physicians.
Well, thank you, and I hope all of you will join me in thanking our panelists for this great discussion.